And I just want to welcome everyone out to our spotlight call today. This is for October. Our speakers are here. We're really excited for this. The title is Earning Trust in Healthcare. MDRG asks the experts. And I'll turn it over to them in a minute. Just want to cover a couple of housekeeping items here. First off, for those who are new to the community, I believe there might be a couple of new timers, first timers here. Just want to say welcome. This community is exactly what it looks like. It's those who are interested in understanding how healthcare is being experienced by consumers, kind of highlighting that consumer point of view. It's an evolution of the Healthcare App podcast, which we claim as the leading podcast about consumer-centered health, and the consumer-centered health group, or the consumer first health group, which is an online community that was organically happened, that we've been holding monthly think tank chats since 2020. So this is an evolution of those two things. And it is a place where we have opportunities to be a little more interactive and be a little more, you know, personal. Use our own points of view in healthcare to share a discussion that is different than what we're seeing anywhere else. So today's session, I'll introduce that. First, I want to thank the team at MDRG for putting this session together. Let me tell you a little bit about MDRG really quick. They're a custom market research firm where senior leadership guides every project from start to finish, ensuring insights with impact. You can learn a little bit more about them on our sponsors page in the platform. They have a link you can check out. They have a monthly insights email, which is great. I encourage you to sign up for that, and you can follow them on LinkedIn. They have a lot of great insights here, as you will hear here in a moment. So I will introduce our speakers here in a moment. What we'll plan to do format-wise is we will have probably about 15 minutes worth of a presentation from the team here. And following that, we'll open it up to you. We'll open it up to questions from the audience, kind of in a town hall format. Anyone is encouraged to ask anything. If a question comes up that you want answered and you don't want to forget it, you can feel free to throw that in the chat in the meantime as they're presenting, and I can ask that on their behalf, or you can jump in during that town hall session and ask it yourself. So either way, that's the goal here, is for you to be able to answer anything you have yourselves. The replay will be available. We'll make that available and send that link out following the presentation, typically within about 24 hours of the presentation. So with that, let me introduce our speakers. We have Sondra Brown, the president and founder of MDRG, and Kristy Roldan, VP of Growth. I'm going to turn it over to them and to share some research that they've done on consumer trust in healthcare. Take it away.
Awesome. I'm going to share my screen. I'm going to lead us through the presentation, but it's worth mentioning that that's not what I wanted to do. Hold on one second. Sorry, I can't talk and do things at the same time. That's not my specialty, so I can only do one thing at a time. Can you see my screen? Okay, great. Perfect. So I'm Kristy Roldan. Sondra is also here. It's worth mentioning that Sondra conducted the interviews. She is the expert. It just so happens that I'm the faster talker, so that's why I'm doing this portion of the work. But she's here to answer questions. And as Jared said, this is a study that we did that's analyzing kind of trust in the healthcare space. I've only prepared about 15 minutes because I sat on the last call and I thought it was really beneficial to hear the Q&A and hear what people think about this. I think certainly trust in healthcare, trust in anything is a big idea. And as we were doing this work, it really got me thinking about what are the interactions that I've had personally in the healthcare space that have guided trust or maybe taken trust away. So I encourage us at the end of that to think through that a little bit and think through kind of what are the places where we wish that maybe we had some more built-in trust, or we were looking for trust and didn't get it. I think that this presentation is ripe for all of those sorts of ideas. You guys hear me okay? Is everything going well? Okay, perfect. Thanks, Jared. Jared kind of introed MDRG, so thank you. The only other thing that I would mention about MDRG before we get into the findings is that we really try and live into this mission of bringing forward the voice of the consumer. And that's important because we've been kind of building up to this idea of trust for quite some time. And when the pandemic first started happening, we did a series of COVID trackers to understand consumer perceptions. And then the pandemic passed, and we did a study to understand the way that consumers are thinking about their options when it comes to healthcare and what's in front of them. And then last year we did a study that was kind of about these ideas of retail health and what's it going to be like when Walmart starts offering healthcare, or Costco, or these other retail, these other retailers. And it brought us back to this idea over time that healthcare really holds the trust and the expertise that retailers don't have. And so that's how we got here today, is we really wanted to explore that more. What does that mean? And what are consumers' expectations around this? And how is this building over time? So for this specific study, we really wanted to lean into our marketing sensibilities. And so we conducted interviews with a series of CMOs, healthcare executives, because they're really at the intersection of kind of making sure that consumer needs are met, while also making sure that the hospital or health system is profitable, staying in business, making sure that patients are coming through the door. So that's why it felt like this audience of CMOs and healthcare executives was really right to talk about this trust issue, because it's, as you'll see in a second, it's kind of pervasive throughout the customer journey and the customer experience. So them kind of being the pencil tip of the intersection of those two places made this feel really right. These are the places where our interviewees worked. I'll note that there's not really a theme in terms of, cities or rural areas or suburban. We didn't focus on a section of the country. We wanted to just get a good understanding overall, no matter where you work, no matter who your patient core is, what these CMOs and these healthcare executives were thinking about and their mindsets when it comes to healthcare, and how marketing is specifically playing into that. One thing that's interesting before I go into this slide is I told you all of this about the work that we've done in the past and how we've landed on trust. And we really thought we were so original with this idea. And this was just going to be like, oh my God, we've got it. We've got to talk about trust. But as we leaned into this idea, we found out that actually a lot of people are talking about trust. So in like the first blip, we were kind of bummed, like, oh, we weren't first to the table with this. But at the same time, it's really validating, right? Because it's like, okay, we aren't the only ones thinking that this may or may not be a problem, and are thinking about what are some of the workarounds that we need to create to make this a better situation for everybody. So that brings us to this slide that we took from Gerard. There's also, we know that there's a big trust study from NRC that's probably worth checking out. I've also read some stuff from McKinsey. We have it all sourced in the full version of this report, so it's all available to you. But this graph in itself is honestly pretty shocking when you think about the absolute flip of what consumers think hospitals are mostly focused on from 2021 to the beginning of this year. And there's a lot of factors that we're going to talk about that go into the idea of why consumers potentially think that hospitals are in it for the money. But nevertheless, these thoughts exist. So wrapping our heads around it is probably pretty important. So this has kind of been a slow build. So thinking about, pre-pandemic, everything was kind of business as usual. But honestly, the pandemic, even outside of healthcare, flipped our whole world upside down, honestly. And then when you zero into healthcare, even, we spent a good time staying at home, doing nothing, not participating in healthcare at all. And then when it was time to come back and start doing more things, well, we told consumers, we only want you to participate virtually. And then over time, we told them you have to wear masks. And then we told them it's okay to take off these masks. And then we said things like, well, I don't want you to participate virtually anymore because I need people coming back to visit us. So I want you to come back in person. And so you can easily see over time, once we started coming back in person, it was really hard to get an appointment. And maybe my insurance premium has risen. And now you're going to tell me that you're using AI instead of a real person. So how is it costing me more and harder to get in when all of these things are at play? So you can easily see I'm being, overemphasizing these facts for sure, but you can easily see how consumers have been told a lot of different things, and those things have changed and evolved over time, and that just layers on this idea of, well, I'm not sure how to be, and I'm not sure who to trust, and I'm not sure what you're even asking me to do sometimes. So just a visual of this kind of compounding issue over these years. Then taking it even a layer deeper, when you think about the customer journey from planning to visit, treatment, and then on your way out the door of the visit, we are putting up barriers that have trust implications at almost every single turn. I'm not going to go into each one of these because I'm going to go through them in, a couple of these examples in the following slides. But at almost every step, trust is called into question. And sometimes healthcare systems and hospitals do a great job of overcoming this, and at other times, not so much. But it's worthwhile to keep in mind that it's not necessarily that we're thinking about trust in all of these things. It's just that there's implications, and these steps over time can erode trust, or it can build trust. And it just depends on the way that you're solving around this. So let's go into this a little bit. Oh, before I do, the other thing that's not a small deal either is, even before this trust issue was starting to take shape, being a healthcare marketer is hard. You have all of these different people that have different needs. You have competing priorities. You have people within your organization that are saying, we have to do primary care. I need my front door to be primary care. No. Stop everything. Now I need you to focus on neuro. We're only going to talk about neuro for the next month. And I need that to be a specialized campaign for, brain patients. And these competing priorities are kind of always at play. Now you're layering on these trust implications. And I have to tell you, the job of a healthcare marketer certainly is not getting easier by the day. It is getting harder. And so just getting into a couple of these things that we're having to navigate in the healthcare marketing space. There's financial impacts on health systems. I don't think that there's a single client that we have that doesn't talk about this. I have to figure out volume. I have to get more people in the door. It's harder to get people in the door. And this has a real, impact. My profit margin is shrinking. My marketing budget is shrinking. All of these things are constant pieces of feedback that I think we hear on heavy rotation. There's operational challenges. AI is one that we'll talk about. I also think that, you know, we're asking a lot of consumers to use digital channels to make appointments or to schedule follow-up visits. And it's not always super intuitive and it's not always user friendly. And, you know, that's compounded by the idea of the next one, which is like marketing and communication hurdles. We want our CRM systems to, you know, send these really personalized messages to these consumers. But is it relevant? Like, we talk outside of healthcare about a buyer has to be in the right mindset to make a purchase. Is our marketing message, even though it's personalized, like reaching the consumer at the right time with a relevant message that makes trust feel more natural to a person to give a healthcare system? That's a big ask. Um, we know about erosion in patient provider relationships. You know, I think that there's just a lot that could go into that alone. And then access and equity issues have been sitting um, in this list for a very long time. And again, just compound this issue of why it is extremely hard, even, you know, even with the average workload, to be a healthcare marketer, I think, today. Okay, now I'm going to talk about some of the, going back to that journey, some examples of what some of these roadblocks are. And the first one that I think that we have talked about, the word access, I think even is like something that is just every 5 words. I mean, if access were a drinking game, we would be falling down the street. It's something that is really hard to solve, and I think that we're trying our best, but it certainly does a really good job of eroding trust. I think to myself about, like, when I take the time to do the pre-check-in online and you ask me these battery of questions, and then I go back to the provider's office and you hand me a clipboard to answer the same questions again. You know, it's just like, it's a little thing, but at the same time, I'm like, do you know me? Do you see me? Do you acknowledge that I've done my homework? I'm a type A personality. I need to get credit for the homework that I have done in advance of this meeting. But, you know, there's lots of ways. I love this quote that somebody gave us about, we've put up intentional walls before you can encounter a human. Anybody that knows me knows I always tell the story of, like, I feel like my most vulnerable point in a doctor's appointment is when they ask you to take off your clothes and you're just in that like flimsy gown, and then they leave for like 15, 20 minutes and you're like, is somebody coming back? Am I just meant to like sit here? I don't even know what to do. My phone's across the room. I'm afraid to get up and go get it. It's like very, very vulnerable. The next one is AI. We asked our CMOs and our healthcare executives about AI quite a bit. It's interesting. We pulled this study from the beginning of the year, and albeit this company showed respondents ads of physicians using AI tools. And on almost every attribute, they rated the doctor lower in this ad. And I don't think that that's a problem of AI. I think that that's a problem of context, and context specifically around transparency and communication. I think that when we think about kind of being prepared for what consumers are going to need to hear. I mean, I'm fine with a doctor saying he's going to use AI because I use AI all of the time. And so if it makes your life easier, great. But we can certainly all get our heads around too that, you know, I think we should be prepared for things like, well, where does it go when we're all done? And who else can see these questions and this conversation that we've had, and how long does it last? And, you know, where all of these things is a script in my mind that as healthcare marketers, we need to think about, and we need to be prepared for these questions, because that's really going to enable physicians to bring their selves forward, which is what the patient ultimately wants, and help with this efficiency. But you have to get buy-in from patients first, and I really think that that's the way that we have to get there.
I just want to jump in for a second and underscore what Kristy said, because I don't want this point to get lost. This study, so I'm a statistician, right? So I'm always looking to figure out what I would have done differently. But while I think this was a really important study, what I think the takeaway is, because of the way that they um, executed on this study, there was no language that explained how or why this physician was using AI. And I think the really critical point is it's all about how we talk about it and the messaging. And we're going to talk a bit about that later. It's not the AI itself, it's that we've got to be very, very intentional about how we talk about it to patients. So sorry to jump in, Kristy.
No, I love it. Don't apologize. Okay. The last idea here that I think is really important is that I'm not sure that we really trust a brand. I guess I could argue that either way, if I'm being totally honest, but trust is really human to human. And so even maybe when we trust a brand, we trust the humans that make up that brand. And I think for a long time with hospitals and healthcare systems, we've been a little bit gun shy to feature our care delivery teams and our doctors and our nurses in our TV spots or in our, I don't know, out of home campaign or whatever it is, because we're nervous that, well, I don't want them to only buy into the doctor, because what happens if the doctor leaves the company, and then will the patients follow that doctor? But I honestly think it's a worthwhile endeavor, because the care delivery team and patients are really the thing that creates the trust. And so featuring people and featuring real life people, and I'm going to talk about what I mean by real life people in a couple slides, is more important than ever. I think that, when we're talking about accessibility or we're talking about AI, there's a lot of things in a healthcare setting that are not human and not personalized. So any moment when we can involve humans is worthwhile to do. Okay, sorry, I lied. This is the last one. This is a big one. We did a study in the beginning of the year with a big health system, and one of the big findings, we did journey work with them, and one of the big findings was that their patients blamed the system for what their payment ultimately was. And when I thought about that, I was like, wow, so like no blame to be had with the insurance company. You get off scot-free. And it's the answer to that is kind of yeah. In the eyes of patients and consumers, they kind of see the insurance company as like sitting up here somewhere, or like the manager at the car dealership that you never see, that's like behind the curtain, that they don't know what's happening. But what they do know is the bill comes from the health system, and the person that they have to pay when they walk out the door of the ED is the health system. So whoever is responsible at the end of the day for the price tag of that healthcare treatment, the hospital system is getting the blame. So we need to think about what we can do to make sure that patients don't feel completely surprised at the end of this. Like whatever we can do to mitigate making sure that there's no surprises at the end of this will go a long way. Even if it's not good news, people are really open to hearing bad news. They're not going to love it, but they will certainly give credit to the fact that, like, you were straight up with me. You told me what it was, and I appreciate that. So just think about that as we're thinking about trust issues along the consumer journey. Okay. So now, of course, you're asking me, how do we tackle this? I just have a couple more slides before we can have a conversation about this, which I'm dying to have. But just a couple things to think about. When we talk to these CMOs and healthcare executives about all of these varying issues, what thematically kept kind of coming up over and over again is these 4 buckets. And I'll go into each one. And I was thinking about it, and I was like, well, some of these are operations and some of these are more marketing, and what's the overlap? But really, at the end of the day, I think healthcare marketers know that even if it's an operations issue, it's still their issue at the end of the day. They're still going to have to communicate around it and find solutions. So there's no even like real reason to split this into operations and marketing, because it's going to get solved by marketing. Okay. So accessibility. I think that as long as we can get better about communicating how to make this easier and how to make even challenges in a consumer benefit, I think is where accessibility can start to play a role. As health systems and as healthcare marketers, more specifically, like understanding what patient needs are. We have a client right now that asks us all the time, like, oh, well, should we be monitoring the way that patients make appointments online, or should we look at the call center data? Or how should we think about what percentage of volume we should be driving? And the answer is both. Like, let consumers come to you the way that they want to come to you, and make it as easy as possible for them to get through all of this gobbledygook to get to where they're trying to go. The second one is accountability. I really like the quote on the slide, on the, right-hand side. The other thing that I'll say is this has certainly happened in my life, and I've seen it happen now. It's like when you see something, you keep seeing it. But when you make a mistake, if you own it and you handle it properly, the relationship gets stronger than it was even when you were just operating at net neutral. Like, making a mistake is not always the worst thing in the world. And in fact, when you show that you're willing to take that on and own it and kind of work through a problem, that really bolsters trust with human beings, like even outside of healthcare, just in human nature. Transparency is super obvious, but thinking about kind of all the ways that we can be transparent. Pricing, I had mentioned, AI, we talked about. And then I think also in a world where consumers and patients are thinking about having more agency in their healthcare choices, doctors that provide options and kind of give, like, I love like a good, better, best solution, and let patients play a role and like peek behind the curtain about what the physician or the care team is thinking, I think goes a long way in bolstering ideas around trust. The last thing I'll say is, going back to this idea of marketing people, people that work for the health system and us as marketers and everything that goes into the building of a brand are its greatest assets. So as much as we can feature them, we should. I think that just the humanization of brands, and particularly in healthcare where it's a very emotional decision, is something that, consumers and patients are going to really look to more and more for that human element to help guide them through navigating choices in general. This is the last slide. Somebody said this in one of our interviews. It was really impactful, so we decided to leave it in the presentation. This is meaningful to me because I, in college, used to work at a restaurant, and the restaurant owner used to always say, if word of mouth looks like this, if people love it, they'll tell one friend. If they hate it, they'll tell 10. And I feel that way about almost all kind of service experiences. And let's be clear, healthcare is a service-oriented experience unless it's a very high acuity, high issue interaction. And so whatever we can do to kind of keep our drops and in fact put more drops back into the bucket, I think, it will float all boats and hopefully make the lives of marketing teams and our CMO groups easier. So that's what I've got. I'm happy to take questions. I'm happy to go back and answer, go back to any slide. Sondra probably has a lot of answers to questions as well. I'm just excited to hear from the group.
Thanks, Kristy. I can kind of facilitate this part. And
Okay.
I can just get it started in terms of the piece that was really right in the middle of the radar screen for me was the order. So when we were talking, start adding in the financial experience aspect of this. And I think Sondra was, in the comments, the first impression is I can't get an appointment. The last impression is an obtuse, expensive bill. I mean, like that's reality. Like we're all nodding our heads because that has been our personal experience. So maybe that's a jumping off point. Maybe it's not. Larry, let's start with you.
Hello, everyone. Thank you for the data. Just as way as context, I guess, quickly. Larry Mead, Director of Strategy for Columbus Regional Health in Columbus, Indiana. Background was in marketing business development. However, I've worked in clinical operations over the last several years with a big focus on cancer. So I want to start by sharing something that echoes what you've said, and then I want to kind of pose my question to the group. So there was an interesting study done in 2023, was published in JAMA by a lot of oncology, Sloan Kettering and a bunch of others. But they did a study on the patient experience with the prior authorization process. And at the end of that study, they found that 72% of patients found the PA process to be just bad or horrible. But the shocking thing that came out of that for me was after the result of the PA process through oncology care, 31% of the patients trusted their care team less. But even more shocking, 83% trusted the health system less. So we think about like what we do with prior authorization, when things get tough. Hey, you've got to call your insurance company. Hey, you've got to file your own grievance. Hey, you've got to, right? So I love the thoughts there around how trust is eroding. We're seeing it happen in oncology care. But so leading on, so my comment and my question, I'm really interested in the group thought. The thing around AI really puzzles me, right? So, like everything else, we get this buzzword around AI. The question I have in healthcare is, why do we have to be so transparent about where and how we're using AI? So, for example, women have been coming in to get screening mammograms for decades. We've been using AI in the screening mammogram world with computer-assisted detection for years. When you get your screening mammogram, nobody says to you, oh, by the way, when your mammogram gets read, we're going to have this computer read it before your doctor sees it. You just come in and you get your mammogram. So I think we got to be very careful in healthcare about, we don't have to be transparent about all of how the sausage is made. Now, in cases where you're sitting down in front of your doctor and you're going to use ambient AI to record an encounter, I think it's good to say, hey, I'm going to use this here to do this because I want to have a conversation with you. But I see there's this rush and a lot of messaging I see out there to like want to jump on the buzz train and talk about all the places that we're using AI. I guess question, how transparent should we be, right? Sometimes you don't have to talk about how you do everything, right? I'm just kind of curious the group thought on exposing AI and everything we're doing because I'll give you one example. Look at what we did with robotic surgery, for example. Right? We went to the market and we were like, oh, we're using robotic surgery. And we show these big, scary pictures of these robots, right? It actually eroded patient trust because they walked away thinking, is my doctor doing the surgery or is R2D2 doing my surgery, right? So I think how do we avoid AI telling the story of AI, but like not telling it too much, I guess?
I want to jump in here. I think that's a really great point, Larry. And um, I actually agree with you. And I think a number of these individuals that I talked to in the study would agree. I think where the communication needs to be very intentional is when it is, like in the case of ambient listening, where it's very apparent to the patient that there's some AI tool being utilized. I think that the bigger takeaway is where, in those types of instances, making sure that we are communicating, one, consistently, um, and second of all, ensuring that the patient understands that AI is not making healthcare decisions. There is still a human, i.e., your care provider, that is involved. And so one of the questions that ambient listening came up across the board in all of these interviews, and one of the respondents talked to me about the fact that marketing had come up with a messaging strategy to explain ambient listening to patients. So it was not left to the individual provider to come up with the words. And what they saw was an uptick in acceptance of use of ambient listening in the care setting. And then he told me was that they saw a slight uptick in satisfaction numbers. So I think that you're exactly right. I don't think everything has to be disclosed, but to be able to have a consistent set of messaging. And so what they would do is they would say, we're using this tool so that I can really focus on you. I'm still going to go back and read those notes. I'm still going to go back and make sure that I agree with everything, but I really want to spend this time with you and be able to listen to you intently. Some version of that. And I think that's the bigger takeaway here is how do we have a consistent messaging, number one, across the organization, and number two, assure them that there's still a care team involved in their healthcare. But interested to see here if there's other perspectives from other, systems of people that are on the call. That was just one example of one interview.
I think too that there's some privacy things, like particularly around women's issues, that you maybe don't always want to be on record. And so there should be a time and a place, in my opinion, where a physician says, this will only ever live with me. So whatever you say here stays with me, or vice versa, before I disclose something that I may be uncomfortable sharing more broadly.
I think that's a really good point. And I do think that's just to jump in, I think getting in that habit, I mean, that still comes down to the individual clinician and their comfort level with saying that. I meant like that's a process in itself of like how comfortable is each one with each patient they have. The last 10 to 12 years of kind of the patient experience movement has been a spectrum of those who right off the bat understood how they set up their exam room and where they're making eye contact like was going to impact the quality of the exam, and others who were just like it doesn't matter. So I think acknowledging that spectrum is there and making it easy for those who are going to be like more likely to share it the way that both of you just described and have that be part of it, the more like that's a very different conversation than, hey, how do you keep patients from not trusting AI, right? Like it kind of focuses on the reason for it, I think. Christine, you had a comment.
Yes, thank you. Kind of related to the bigger issue of trust and whether it's AI or even the consumer dissatisfaction with pricing and really directing that anger or frustration at hospitals and systems, it feels like there's maybe a shift around, what does it mean to have a compelling or a strong brand? And it feels like maybe the role of the Marcom team, where it traditionally sits, from what you've shared, is becoming more like an explainer of things, which is like kind of contextualizing or explaining AI, contextualizing or explaining pricing or price transparency. So I would just be curious for your shift on kind of what feel like more functional or operational things, but are how people experience the brand, maybe more as a transition from a more traditional Marcom approach, which has been brand around kind of brand and image advertising, or, you know, US News and World Report kind of as the proxy for a strong brand or strong clinical brand. Can you just dive in? I know it's more of a little bit of an essay and a little bit of a question there, but it feels like there's a big shift here happening in how you define how people experience a brand and maybe how we need to talk about it. Is that what you're seeing? Am I interpreting that right? Or could you speak a little bit to that? 'Cause I think so much of what you touched on is really operational in nature and functional, but it is impacting that brand perception.
Yeah, I agree. And like I said, I think that there's a lot of overlap in operation and Marcom because it's like, operation has to deliver what Marcom communicates. But I think from the Marcom side, Christine, you want me to talk about the Marcom side or operation side, just so I'm following along with you.
I think on the Marcom side, because I think,
Yeah.
oftentimes it's easy to be kind of caught in that traditional, like we're talking about advertising campaigns and kind of go to
Yeah.
market strategy. But oftentimes, again, it's like you said, it's the promise, but really is our time better spent connecting with operations and also infusing that into our go to market strategies. So we're kind of serving as the explainers of maybe what's most important to folks. Like you mentioned, price, access, other things like that.
I definitely always think that there's opportunity for marketing and Marcom to be working more closely together. And I definitely think that if you don't have the backing of having, the people that have their boots on the ground, delivering on what the promise is, then, we're not going far fast. We have to make believers of our internal teams before we ever deliver a message to a patient or a consumer. So that we have to all kind of, I don't know, beat the same drum, so to speak, about what our promise is going to be and how we're going to get there. And I think we could talk about all of the operations things, but I also think that Marcom can help in the sense of kind of delivering back to operational teams what they're seeing in a consumer lens. What are the consumer insights about any topic so that they can understand? I think that, you work in a hospital system and it becomes kind of like a fixed little city onto itself, and we sometimes lose vision around what the outside world is thinking and feeling. And so I agree with you, Christine, that Marcom's job is to educate, but educate in the sense about what some of these challenges are, but also educate in the sense of like, what does the patient or the consumer need from us at the end of the day?
Awesome. Thank you.
If I can make a comment too, I mean, I think it's interesting too that while I think there definitely are organizations where strategy, Marcom, operations, they are working closely aligned. I think part of what's eroding trust is the authenticity part you talked about, because here in Indiana, for example, and even nationally, but definitely in Indiana, I still see a whole lot of marketing of what they hope will be and not what is. And right, so it gets to the authenticity part, right? You'll see advertising from Marcom teams, right, that says, we're here for you when you need us, as long as that's not Friday at 4:30, right? You know what I mean? So it's like, and so I think that authenticity part, I think, is a real challenge for marketing teams, because I think they're wanting to tell relevant stories. They see the data, they see the research, they know these things, but operationally, if we're just not there, we end up marketing a lot of times what we pray and hope in our meetings will be the case, that I'm going to pray that when this person calls, we're going to be there when they need us. And then it kind of fall through. So it's a real challenge. And I know Jared talks a lot about this, about, the operations and different things, but yeah, it's a challenge for the Marcon teams without doubt.
Yeah, just to piggyback on that, I mean, when we are working with clients and doing positioning work, I mean, what we're trying to find for, the holy grail is something that's unique and differentiating, but is also true for your organization. And both of those things, so we're here for you whenever you need is not true at this point. And that then has a negative impact on how your brand is regarded. Christine, piggybacking on what you were saying, I'm sure anybody that knows Matt Gove has heard him like screaming this from the rooftops, that brand is equal to the sum of experiences. And I think he's kind of been talking about this for a long time, but I think that's what we're talking about. It's all of those experiences that ultimately then inform you and inform your brand and how your brand is perceived. And so we just cannot separate Marcom and operations. They have to be integrated. We've done not a great job of that historically, but we have to do better.
I can add one more layer to that. One thought on that is, in every health system's 2, 3, 5 year strategic plan, it talks about improving consumer experience, or improving access, or improving outreach, or improving other marketing or Marcom initiatives. It doesn't always say what you just said, Sondra, of like, how do we do that? By getting marketing and operations to the table throughout that process, because it is absolutely in the intersection of those two, playing at the table at the same time, understanding what those shared goals are, rather than kind of yelling at each other from a distance. So I would absolutely echo that. You see it in everywhere. We have a couple more minutes. We're running a couple over, but if anyone else wanted to chime in or have any questions for Sondra or Kristy. I know Drake, you just had a comment here. Didn't know if you wanted to.
Yeah,
I could read that for
I
you.
I think the brain scientists have figured out that we're programmed to remember negative things better than positive things, right? Because knowing there's a tiger under the tree is more important than how beautiful the tree is. So we tend to remember everything bad that happens because we want to avoid it. And right now, healthcare is primarily shows up at bad times in our lives, right?
Yeah.
Like if healthcare could figure out how to be a part of the good part of our lives, that would generate a lot more good memories. And I think that needs to happen if we're going to overcome the negative average.
Love that. All right. Well, with that, we'll wrap up today's session. Sorry, Christine.
Sorry, I have
Right.
one more question if I can do that. Actually, lots of
course.
questions, but curious too, kind of outside of healthcare, as you do work across industries, are there any emerging best practices or even some things that are already established best practices in other industries that healthcare just hasn't been doing that you're seeing that we could learn from that are proven? I feel like sometimes healthcare is a few paces behind what others are doing. So I'd be curious for any other insights from other industries.
Interestingly, Christine, I don't have like a best practice, but just thinking about the projects that MDRG has been doing lately, and I forget if I told you this before, but for some reason, we're speaking about operations and marketing, we are being asked to do a lot of internal workshops these days. A lot of we're going to bring the people together and you facilitate the conversation. So it does seem like a lot of this is top of mind, that we have to get our house clean before we go out into the world. And our business has kind of shown that from the project perspective. And then I think, obviously I could sit here and plug MDRG and say, like, you need to keep a pulse on your consumers and make sure you're talking to them all the time. And, you know those things, but you guys are pretty good about that part. I would give healthcare a good grade for that. So I think it is more of, unfortunately, getting people out of their silos and getting people talking.
Perfect. Thanks, Kristy. So we will wrap today. And yes, we will share the deck, Larry. We'll share that out along with the recap and a replay of this whole session that can be shared out for everyone. I want to thank Sondra and Kristy again. Want to thank everyone for attending too. As usual, looking for feedback on the session itself, what we can keep doing, what you want to keep talking more about. We will infuse that into not just events here in the community, but on the podcast, in our newsletter. Just love knowing what's resonating with everyone and what we can keep talking about. There was a lot to go on here, so I want to thank everyone for joining today. Hope you have a great week, and I will plug really quick our next couple of events. We do have spotlight calls in November and December. And we just have all-stars throughout this whole thing. But November 6th, Dr. Gordon Chen, so one of the Chen brothers from ChenMed, he about a year, maybe a year and a half ago, started a new company called ThriveWell, and he's going to talk about what we can learn about longevity from the experience of creating their company. So super excited about that. And then Wei Li Xiao, the president of Omada Health, is going to be with us in December 10th. And there's a lot to talk about there with the GLP-1 market, especially. So we'll keep these things going. But as always, check those things out in the platform. You can RSVP there. So hope everyone has a great day. Thanks for joining us.
Thanks, Jared.